Well,
It's not uncommon to see patients with severe diabetic complications that suffer amputation coming from ingrown toenail as well.
Hello and welcome to another episode of We Need to Talk About This. Now, today's episode is all about ingrown toenails.
fun, fun, fun. And we have Jackie with us, who's an expert, and he's going to explain to us all about it. So, ingrown toenail, how does this work?
So basically, ingrown toenail is a medical condition whereby the sides of the nail actually cuts into the skin or the flesh of the toe. So it's actually quite painful and can be quite debilitating. So patients who normally have that condition will have a lot of pain when they try to walk or when they try to wear enclosed footwear, whereby there's pressure along the side of the
Like
the
heels?
toes. Essentially, heels, even pointed toe kind of shoes. In fact, when it gets too serious, even simple sports shoes can cause a lot of pain as well.
Let's take a look at some pictures of ingrown toenails. Well,
It's actually, as you can see, it can be quite graphic. So you can see how curved the edges of the nail is. So it's almost like a pincer shape.
So wait, what's underneath?
The patient actually had this kind of curvature, increased curvature of the nail itself, and he suffered a trauma on top of it. So there's like a major bruise underneath the nail, turning the whole nail black in color.
When you say trauma, what sort of trauma?
So it's as simple as either you drop a heavy object onto the toe or someone just accidentally stepped onto your toe.
This looks okay. This
That is
doesn't
not
look
too bad.
terrible.
But essentially, you can see the nail edge is curving so deeply onto the side of the skin, it's just causing a lot of pain and swelling on the big toe.
so once you damage it, it will always grow back like that?
Depending if it's just a sudden, like a once-off kind of thing, but your eventual shape of the nail didn't change any further. But if, let's say, the nail starts growing more and more curved, you can be stuck in the cycle of a recurring ingrown toenail.
So if they're in so much pain, how do they alleviate that?
For us, when we look at the ingrown toenail itself, we have to see the severity of it. So is it just like a piece of a nail spike that pokes into the skin, where we can just remove the little spike over there? Or if it's coming from down the root, whereby the whole entire nail is very curved,
Shifted over to the right side.
then we
or
have to
left
do
side.
something more sort of invasive in a
Oh,
in a
this is
way.
on both sides.
So essentially what you're seeing over here is when someone decides to neglect the early symptoms of pain, discomfort, and they choose not to do anything about it, and they just bear with the pain throughout until it becomes really, really chronic, that you can see that there's two little lump of tissue that grows on the side of the nail. And those are actually sort of our body's response to try to break down the nail, but we couldn't. So it forms like this kind of, we call it hypergranulation tissue at the side.
So this person's in a lot of pain.
It's actually in a lot of pain, but
So my question is, before it gets to the painful stage, is there a way to spot or to know that you're...
Actually, you do. So essentially, what you can look at your nail is just basically if you have a little nail file or something like that, you can always easily try to pry the side of your skin out that way to see if you can locate the nail edge, the end of the nail.
I've done that
easily.
That's how they do it in pedicures and manicures and stuff.
Essentially, But we don't really want to cause too much trauma by doing so.
Right.
So it should be easily identified. So if let's say you find it difficult to really spot where the ends of the edges is, then that's where you know that your nail is really, really curved in, and that could be a sign of an issue. So what you need to then do is more of a preventative measure. So when we say preventative measure, you try to, of course, avoid any trauma in a simple way. The way we cut our nail, so that's all leads to what can cause it.
So I like to try and cut all the way as far right and left as I can on the big toe. Is that good or bad?
Essentially, that's the improper way of doing it, to be honest. What we try to always advocate is to cut your nails straight across, but that leaves a sharp corner, right? You can just use a nail file to round it off.
Leave a corner that's outside of the skin, right?
Correct, because you don't want the flesh to sit above the nail. You want the nail to sit above the skin.
Stop doing that.
Apparently so,
Exactly.
Does getting a regular pedicures do anything for you?
It really depends on the technique and the skill they actually have, and whether or not they do know how to identify the severity of the ingrown toenail. Because you do have, we do have patients who've been to pedicure, and then of course, where the spike is not fully removed and there's still something poking into the skin, and that results in a more chronic situation because when you try to remedy it yourself, you find that it's so difficult because it's a tiny little spike that sits so deeply inwards, then you can't really get it out, and then you have to seek a medical attention.
You know what? I always thought that since I go for like a manicure and a pedicure every month, that I'm safe from ingrown toenails. But what you're saying now is that I'm not.
You know how they like to shape it in a very curved manner, like a rainbow
right.
kind of thing, to make
Yeah.
it look good. But that's what we don't really want to do when you cut the nail. We want it to
That
be
means it's
straight
starting
across.
to dig in.
Correct, exactly. And then to actually achieve that, they will tend to push the cuticles to the side so they can cut more of those nails out. But that leaves you to a risk of developing an ingrown toenail.
So now I've got a bad ingrown toenail. What do I do?
If it's just pain and discomfort, sometimes you can try to do something at home, like a little warm foot bath, stop wearing any tight-fitting shoes from then on, Try to see if you can just apply some antiseptic, make sure it doesn't grow into an infection. That you get something you can do for yourself. But if, let's say, within a week or two, it doesn't resolve, it's getting red hot, swollen, it's getting quite unbearable, you do need to seek a medical treatment or advice. That's where we decide whether or not is it just a simple that we just remove a little spike, or we have to do something more invasive to it.
Apparently we have a video.
So we normally start off with just sterilizing the skin down that way. But before that, of course, we inject some local anesthesia. So
Right.
you can pretty much sit up and watch this yourself, to be honest. Yeah. So once it's numb, you don't really feel
What's
anything.
this?
So we're just putting on
Spongy?
a tourniquet because
Okay.
we don't really want blood to keep oozing while we're trying to do this. So then next thing, we will try to free the nail
Oh boy.
from its flesh. and nail bed.
Oh, boy.
Yeah. So we're just freeing them
Oh,
up.
yo.
And then we'll split that nail up so that you're just removing the curved portion of the nail.
Right.
Yeah. And then we'll just slowly sort of dissect it down underneath the skin. So you don't have to cut the skin at all. Yeah, it's all done minimally invasive anyway. And then that's where we extract that curved portion out. Look at the size of the nail when it comes out.
Oh,
Yeah.
oh my goodness.
But
that is...
when you look at it, you barely see anything, just a small tiny gap. Look at that. We just applied a chemical to sort of burn off the root so it doesn't grow back again.
Actually, what does it look like pre-surgery?
Pre-surgery, what are we looking?
So we can see in this particular case, the nail is not really curved, but the nail is extremely wide.
Okay.
So it cuts to the sides of it. So the moment we remove it, you can actually see the clear gap at the side. There's nothing impinging the sides anymore. You might be wondering, after the procedure, it's going to be very painful. Actually, you don't really feel that much pain.
Okay.
Okay, so what would your parting advice be for anyone who has ingrown toenail, is starting to see an ingrown nail?
I would say that if anyone suspects that they have an ingrown toenail, coming from like discomfort or pain, it's always important to seek medical advice earlier. You don't really want to neglect it. You don't want to let it brew into a bad infection, like a really swollen toe. In Singapore, diabetic population is on the rise.
Okay.
Yeah, so people with immunocompromised issue, they should also seek help earlier. If not, they can actually brew into a pretty bad infection. It's not uncommon to see patients with severe diabetic complications that suffer amputation coming from ingrown toenail as well. Yeah, because it can actually lead to a bad infection.
Jackie, thank you so much for being with us.
welcome.
We appreciate you. All right, guys, that does it for us in another episode of
We Need to Talk About This.
See you next time.
If you enjoyed this clip, don't forget to catch our main series, Let's Talk About Health, on Channel 5 and MeWatch.